move on. Our third speaker is Dr. Zuhra. So Naz is again a Zaudin trainee, just like Mavish. So she's a pass out from Zaudin. She is currently working as a senior specialist registrar in respiratory medicine at St. George's Hospital. She's done quite a bit of work in PACES exams. She's going to talk about specialist training. So we've not divided the specialist training into different ones. So it's a national recruitment program that you go into and you apply for a particular training job of your speciality of interest. They take it from there. You're required to have your MRCP prior to that. And Naz is going to shed more light about the interview process and when it is and how it needs to be done.
Hello, everyone. My name is Dr. Zuhra. I am a batch 8 Zaudin graduate. And today I am talking about the higher specialist training in the UK. Thank you. Yeah. Sorry, so learning object today, so we know about how to enter higher specialist route via training or non-training. Both of the route we can enter into higher specialist training, but definitely the non-training route is a bit more harder to accumulate all the requirement, and I will talk to you. Yeah, so this is overall my friends and colleagues and spoken to about this thing. So this is an overall view of how the distribution of the training in the UK is. So after graduation, there is a house job, as I would say, like equivalent foundation. And then, so every orange column is saying you need to sitting in the interviews or you have to pass some certifications to eligible for the next level. So after foundation, you have to decide where you're going to do, what your specialties aims are, and then you're able to join or apply for a next level. And after you've done your core trainees or IMTs, intermediate level, then this is I'm talking about the higher specialist training when you cross your previous 2 stages towards the route to the consultant. Next. Thank you. So how to choose your medical specialty? So I think this is we talk to all the immigrant, all the new doctors all the time. I think for me, I feel like it's more about personality. I mean, like what kind of the personality you're wearing, you like, you are very enthusiastic, you like some procedures, or you like day-to-day seeing of the patients, or you like a bit a calmer environment or less acute side. So it's all about how you perceive as a person, you can cope and you can achieve. And patient contact level is the same, just like if you're choosing acute medicine, every day with lots of patient contacts. But as a physician, I like to follow my patient and see the result, what I am doing. But in some specialty, we just do the basic or acute management, and then they'll try it in the different specialty. So it's always depends on what you like to do. And training schedule and time taking to reach consultant levels. How long do you need to train, for how many hours are required, and what's your consultant, what hours you are required to work. That's very important as well, that some specialties come with a general medicine commitment and some are not. So we will go through in the next slide. So next I have to think about if, for example, I want competitive, there are, sorry, let me go back. Back. Thank you. So then we have to think about our specialist interest, how competitive it is. Some specialties like cardio, respiratory, gastro, dermatology, they are very highly competent, required competency ratio. It's not about overall. When we get the result is our overall, then we have to see our competencies level, which region of the area or UK dictionary we are fighting for. So the ratio or the competition rate increase because most of the UK trainee and graduate like to remain local, and they have a very, very good CVs, as Omar said. So it's a competition. And career progression, what you want to achieve, you want to remain as a physician only, or you want to think about medical education, want to having a medical director in the future. So you have to start thinking about what really your ambitions from the beginning of you start thinking about getting a subspecialty. Stress management is very, very important. So this is I think a link with the personality. Then how do you cope with the stress? So could you work in the high pressure environment of acute medicine? Because as a medical registrar, you are the one who are the senior most in the whole hospital. Either it is a 450 bed hospital or it is an 850 bed hospital or 1200 bed hospital. It depends which hospital setup you're working, because it's a rotation. We rotate from district general hospital to a tertiary care hospitals to enhance our knowledge and our caliber as well. So I think stress management is very important. That what is your personality, how much pressure you can take, because we have a pager, bleep, and sometimes 3 hours we are sitting or standing the same place because everybody keep asking us question, getting referrals, rejecting referral. So it's lots of communication and lots of brain storming is going on all the time. So I think it's very important. Stress management and the personality type is very important. What we are choosing in it. And then do you like research, data analysis? So this is the other thing we can think about, whether we like to have some kind of educational post, or we just purely want clinical post, or we involve later on that. And then problem solving, and we are straightforward care, practice structure work, etc. Next, please. Thank you. So this I have taken from the GRCBT website. This is just newly they have, because they just 2 years ago, they just changed the training. Basically, we used to, as Omar said, it used to be a 2 years core medical training, which I did. And then we have to apply for specialization. Now they have added a one more year to make it stage 1 internal medicine and then stage 2 internal medicine or sub-specialization, whatever you feel or want to opt for. So, and the right-hand side is the most, left-hand side is the most common route. So it is about the, what is straightforward when you are a foundation, you have a IMT2, so you have IMT3 and you do, and then you apply for the job. So these are the thank you. So this one is about, thank you. So I think this is important for the people who are not local graduates. So trainees within 3 years of leaving CMT, or these are the people we are realized as international graduates. So either some people just come to the UK and never go to any training post, they remain as a trust grade doctors, but they're working as a level, or they're filling the gaps, or working like a senior house officer or a CT1 or CT2 levels, but they can do from that, they will get all the competency and they get signed the forms here after they have experience, and they're eligible to apply for the training. And some people who have a previous, for example, MRCP from back home training, they can get also the alternative competencies and come back. And the right-hand side, it is the Omar said, as these are the people who are, most of the time are the local graduate, or very few I have seen ACCS trainees as who are immigrant. These are the basically route, is very special route for very enthusiastic people and who are full of ambition and they want to do something. So they are, and they're not sure which specialty is for them. So this includes anesthesia, emergency medicine, and normal medicine. So what they do, instead of 3 years training, now they have 4 years training. And previously they used to have 3 years training, and we used to have 2 years training. So everything 1 year incremental year. But that training, ACCS, give them the personalities who are highly ambitious, or they're not sure which to specialty choose, especially if you're interested in emergency medicine, acute medicine, or if you are interested to be an aesthetist, completely different. So this specialty help you to choose between what you like to have. And in the end, if you like medicine, then you can get all the competency and get into a higher specialist training. So this is a plus point. So you can go into 3 specialty via one route. Thank you. Next paragraph. Next slide, sorry. Yeah, so though this is a overview for what is we are here. So this is an internal medicine training. This is stage 1, 3 years. And selection is over. Talk about all interviews, sittings, and then we apply and we get selected for a specialty and internal medicine training. And this is about 4 to 5 years. For IMT people, we need to have MRCP. We must have finished our MRCP degree here to eligible for the next stage. And then we have exit exam called SCE. And then afterward, we become consultant. So next slide, please. So your application process is now completed, as Omar said, on online system called Oriel, which allow you to view vacancies, allow for posts, book interviews, and manage offers all in one place. So this is, don't forget this email, this website. So you need to check and register with it. So you know which training post. Sometimes strain role, especially for the juniors, stand on FY2 post, also come on this one. So check it, keep checking this one if you get a chance or get into a training at the very, very initial stages of your career. Next slide, please. Next slide. I think back. Yes, so attested recruitment. So we have 2 rounds, round 1 and round 2. Round 1 is usually start in November each year, and interviews commence from January till April. And the job most of the time is start in August, but some deaneries like London deanery, just like they all start, or they depend on the training as well. If you're gastro trainees or RASP training, they start in October instead of August in most of the deaneries. And round 2 for the people who are the seats are remain unfilled, they re-advertise it. And they are started in application start window start in July, and interviews start from August to October. And then job commence from October till April next year. So it depends on a deanery you are selected for. For this year, round 1 is closed, and all my IMTs are, especially London side, I know they are waiting for the interviews result and selection side. But, and this is the website, I put it down for you guys for the recruitment process and timeline. So you always check if any change in the timelines and when you can apply and what time is going to be open. Next slide, please. So what we left with, we still have some hopes. So we left with a round 2 recruitment, and which is going to open on, publish on 13th of July, but it's going to application window start from 26th of July. So this all you can see, they nicely say to you, what is the application time? When the shortlist, you will receive an email when you're shortlisted, and they will, and this is also in the Oriel, you get a separate message or emails. So they will give you to book your interviews and things. So we have a second round is awaiting, and there's a chance whoever is interested, they can apply in the second round for HST. Thank you. Next slide. So eligibility criteria, the main thing is MRCP UK, you have to have it to enter into higher specialist training. And then you have to maintain your all competencies. For example, you start as a foundation level. If you do F2 standalone or foundation is great. If not, you should have your alternative certificate to be signed off. You don't need to re-sign it again and again, but it should be in your records. And then we have to have IMT. So if nowadays the training, as Umar said, is very, very opportunities are arrive, your market competition and the things are just eliminated, and everybody have opportunity to apply what they want. They just need to just focus and want to do it, then they will get it. Anything they want, I will say. So after you get your IMT3, So these are very important, because our foundation trainings, our core training, IMT trainings, we will get our pass certificate, or we have got our supervisor report from ARCP and and then they will say like, yes, we are completed this stage of training, and we are competent on all the things they tell us to complete, including procedure and including our other requirements. But this important thing for the people who are coming from other countries like us, like Pakistan, some people not come in earlier age. They come after they have their FCPS and they did MRCP along with that, and they say like after MRCP they will be eligible to get registered from a GMC, and then they think like they already were consultant there in the back home. Can you go back, please? So what they'll do, but they here, even you have a training there, you will start here as a registrar level, because the here training is quite intense and quite long as well, and there are lots of requirements. So what they need to do then, they usually start at a trust grade or a specialty doctors, and they will sign their alternative certificate. And I put it down, the link here down. So in the document library, you have all the forms, because they are 12 pages long. I don't have a capacity to put it down. So it has to be signed by your supervisor, either is educational or your clinical supervisor. And it has to be you work with at least 3 months. And most of the time, unfortunately, because their forms is so extensive, so your supervisor might not see it. But don't worry, if you're doing your on calls, and anybody can, the 2 or 3 consultants can share the same form, and they can sign it, and you can get your alternative certificate signed off. And then once you get it done, then you are eligible to apply for a HST. But who are the trainees and waiting for the MRCP result, they allow the trainees to apply if they're able to pass the exam before commencement of the post. But for the people who are coming from abroad, they don't have a exam. There is no, they can apply probably, but probably they won't get it anyway. Next slide, please. So application marking, I think Omar is tell in a very detailed as well. So these are, majority of these core marking is not changed. The most losing points are undergraduate degrees. So most of the time, all the whatever I see here in London, most of the the graduate program is usually people opt for 6 years, 1 year for intercalated BSc, or related to healthcare, or anything like business management. So they do have a undergraduate intercalated degrees, or they have a BSc before starting off their degree of MBBS. So they have a very good point there. Most of the immigrants lose their points. And postgraduate degrees and qualifications, so certificates has no points. So you have to have either a diploma, or you have to have MSc to gain that point. Additional achievements, so as Omar said, do you have any distinction, any gold medals, and anything, any certification that make you are better than others, basically. So that counts as well. And your MRCP UK degree itself has a good marks. So if you are applying before completing the MRCP UK, so you won't get a full score on the application. But once you come to the interview, they redo your scoring with evidences. So you can gain or lose anything which is discriminating. So this is the thing. Presentation and posters. So the marking for presentation and posters are usually national or international, I'm afraid. You can say like your local one, but they don't score very high. The mostly time, that's why we encourage our juniors or the people around who are coming new to the UK to involve in some kind of a projects, part of them, even you know, having a small contribution, but you're able to go and present them. So they have a very high score in the side. And here in UK, if you go to, I remember when I was a co-trainee, I went for my poster presentation in Liverpool. And they are very, very young people around them. I am afraid why they're so looking very, very teenager. And then I talk to them and I come to realize they are just first year to second year, third year medical student, and who are projecting their posture. So yes, they are into that since very, very beginning. So they do have a very strong CV, even they not do perfect, even they do effort or not, effortlessly very good CVs, because the system built them to have all these scores what we require to get a better CV or better scoring for the future. Publications. So publication you can use anywhere, to be honest. Many people I've seen, they use their publication they have back in Pakistan or here, so that you can add on. They do have a good numbers on the publication, but you have to give them evidence that is been published and the articles number and date, and sometime you have to scan it and put on you when you go for the interviews. Teaching. So teaching is you can achieve that. You can do a certification, you can do a bedside teaching, and I think this is easy to get in terms if you contact your postgraduate organizer or coordinator. These are the people you have to write it down the email and say like, oh, I am interested to teach the medical student, for example, co-trainees, whoever is around. So we just do it. And then clinical audit and quality improvement. Next paragraph. So interviews, I think we don't have much time, so I just put it down. It's 20 to 45 minutes. We can discuss sometime later in full interviews and what we're expecting. Next paragraph. Sorry, next slide. Competition rate, you can check it on specialty training, and it's vary every year. And different specialty have some specialty have a more competition and some have a less, and we have to think what is we want to achieve. So a concern of many trainees applying for medical training is the work-life balance, and how do you cope with insistence nights and weekends. So I feel like be good to yourself. A sustainable work-life balance is achievable but requires some effort. Recognize that you will need proper downtime, and don't be hard on yourself for having days when you do nothing. While the nights and weekends mean you miss many regular social events, being free at other times can open up possibilities would have been otherwise unavailable. Make good friends of similar interests. Those will feel like a family as time progresses. And I will suggest that some of the rotas, depend on the hospitals, are different. So plan your off days in advance and try to have one extra off after your night or weekend long days if rota is not friendly, to avoid burnout. Thank you, I think. Next slide. Thank you, guys.
Thank you so much.